Your status symbol is not sitting in your garage. It's not your Rolls Royce. It's sitting in your wrist as your whoop. The moment you have more money, what do you want? You want more access. You want belonging. You want more private access. That's where just having a gym is not cutting it for them. Blood work changes every 3 to 6 months. For you to see any autoimmune or metabolic condition brewing inside your body, it takes about 1 month, 45 days for the parameters within your blood panel to change. But what is the thing that doesn't change is your genetics, right? The genetic predisposition is the gateway for you to understand what you should do next for your body. If I were to tell you today, Gayu, 10 years later, there is a high chance you might have a heart attack. What will you do? Will you wait for 10 years or will you start taking charge of your health now, right?
Most people think healthcare starts when something goes wrong. But what if you could predict the risk earlier, personalize treatments better, and extend not just lifespan but health span? Hi, I'm Gayu Lewis, a board certified integrative nutrition, health, and menopause coach, and the host of the Gayu Lewis podcast. This is the space where we talk about what's happening behind our hormones, from science to mindset, to everyday stories that help women thrive through midlife. And today, I'm joined by Mohit Ahuja, founder of Verve Partners, the UAE Peptide Clinic, and the World Biohack Summit, one of Asia's leading biohacking and longevity events. We'll discuss what's working, what's failing, what's overhyped, and what could genuinely transform the way we think about health over the next decade. Mohit, welcome to the podcast.
Thank you, Gayu. Thank you so much for having me here.
Just addressing the elephant in the room right from the beginning, healthcare has been evolving continuously. But what do you think are the trends that are genuinely helping, people or us transform healthcare in a better way? And what trends do you think are just hype?
I think, let me start by UAE being a very progressive nation, especially Dubai being now crowned as the wellness capital of the world. Initially, it used to be all Miami. So the trend is still whatever picks up hugely in the US, in Miami, sort of makes the rounds. And the next region it sort of hits is Dubai. And we've seen that any new legislation being dropped by FDA gets picked up here. And I think it's one of the only nations which have 3 regulatory bodies purely focused on health. We have DHA, DH, MOHAP. And now EDE also in the picture, which is Emirates Drug Establishment, which was recently formed. So I think from an overall nation, it's the best place to be when you're looking at healthcare, actually healthcare, not the hospital, not the sickness industry, but the healthcare. But coming to the trends, we've seen, I think, a huge surplus of wellness clubs being formed, right? Initially, it used to be a clear demarcation between gyms and our medical centers for that matter. Now everything in the middle, the void which was there, has been taken by your biohacking centers, longevity centers, IV specific centers, and especially all the gyms now. Just having the best state-of-the-art equipment is not doing it. So now the trend is everyone who makes more money, right? Because a lot of these things are still for the elites. So the moment you have more money, what do you want? You want more access. You want belonging. You want more private access. That's where just having a gym is not cutting it for them. They want the gyms to have saunas. They want the gyms to have ice baths. Then I think this is the biggest trend that has been there in the last 2 years. Then I think everyone's aware of what's happening with the GLP, GIP industry. So I think from a legislation point of view, still there aren't many human trials to support that. And now after GLPs, we have obviously the peptide trend, which has been there. Post that, I think everyone just wants to go on social, follow the next influencer, and boast about their stack. Having my stack, my stack is bigger than yours, my stack is better than yours. I think these trend, whichever makes them look more polished, more healthy on the outwards, then on the inwards, as a trend has been just making the rounds across UAE. Now, as we go through the podcast, we will go deeper, but I think these are the macro trends which have been picked up by everyone. And I think everyone wants to be super about quantifying their data. Now, I did a panel recently and it said that now Your status symbol is not sitting in your garage. It's not your Rolls Royce. It's sitting in your wrist as your Whoop.
Yeah.
It's sitting on how you look. It's sitting on which gyms you go to. Do you go to a Peak Wellness, a Grey Wellness, or are you still going to one of the conventional gyms? These things are clearly trend worthy, might and might not help your overall health.
Yeah.
But anyone who's looking at you, anyone who's following you on socials, they need to see where you're going and what you're doing when it comes to your health.
That is very interesting. I think it's time to sell my Range Rover and probably get a better membership, I think, from a gym perspective. Yeah, very, very interesting to know. But, looking back over the last, 5 to 10 years, what has actually surprised you completely? You told me that the whole shift from healthcare, like just hospitals, and the bridge has come up. But something that's completely surprised you, because you've been in the whole health and wellness industry, right? You started the biohacking summit and stuff. So you've seen it develop. But what's completely surprised you?
I think the pace at which the UAE supports any new health movements, any new health therapies, which has a longer view into the macroscopic things of it. Now, I'll give you an example, right? Ozone and Ibu treatment.
Yeah.
It's a very common treatment again in US.
Yeah.
So now it's not regulated in the US. It's in fact, I think, illegal as of now. So a lot of people come down to the UAE to get these very specific treatments. Now, what that does is it's a signal, because these treatments are not for the masses. It's for the elites.
Yeah.
And UAE is actually inviting these elites that, you know what, we have the vision, the honorary government, the honorary families, they have a very good vision on how healthcare will be perceived in Dubai, not just now, but the mission with 2030 and 2040, which invites a lot of these people to come to Dubai, have these treatments and witness. It sort of seeps into the medical tourism, it seeps into the real estate, because everyone who's made the money, what is the next priority? They want to live longer.
Yeah.
They want to live sharper, they want to live longer, and they want to live for a very hearty life, right? When they see UAE supporting these causes, they think that yes, I can see myself living here, because I think security and safety has always been the pioneers of UAE. But now when you start looking at health, I think this becomes a very good option for them to be here. Now, some of the things that have extremely surprised me. First is the entire GLP, GIP, peptides, sort of how it took over.
Yeah.
Then how UAE now has so many conferences focused on not just overall medical or the hospital side, but there are specific conferences on stem cells. There are specific conferences on biohacking in general. If you search for terms like biohacking and longevity, in this region, if you go to trends on google.com, you will see a very high number of searches happening here, which shows a very high degree of awareness within the people here. And also with the diversity that we have, you have people from all across the world here, right? So everyone's sort of bringing their own nuances, which gets accepted here. To give you an example, again, both of us coming from India, Ayurveda has a huge market here. We have Wim Hof and his daughter Kamif. So all your the Wim Hof breathing, which is very Icelandic and very Slavic, that has a huge market here. The Banya concept of Russia has a huge concept here. So these mini concepts, how soon and how well they get integrated within the Dubai's macroscopic wellness infrastructure has been absolutely astonishing. If you were to do the same thing, you go to India or you go to even UK for that matter, it takes time to build these things up. But there is already a community here, and those things coming here, it just flourishes.
Yeah, but don't you feel that they again are very short-lived? I know there was one time where everybody wanted to jump into the ice bath. Right?
Yes.
It was just a trend, more on social, just to show that I'm doing this really cool thing, that even though you could not survive even 2 seconds in that water, but for social, you just wanted to show that. But I think that was short-lived. Now you very rarely hear about ice baths being popular. Now there was then the cryo that picked up, and I think cryo is also kind of going towards the decline in general, right? From a coolness perspective. Right now, like you said, it's the Ibu, or it's the whole ozone therapy, trying to remove, this is the amount of toxins that I had in my body and I'm flushing that out. That's kind of somewhere the newer trend. That's what I'm asking. These trends are all very short-lived, don't you think so?
No, absolutely. Like I would say 70-80% agree with that. But there are some brands who are actually doing very good when it's this. Now, this is how I approach this particular problem, right? Most of the people, what they try to do is, firstly, just when they do the marketing, they purely focus on the technology. Like we have cryo, we have infrared sauna, we have the ice baths. But then you have the next layer who actually go ahead, who try to educate, aware people that these are the benefits and these are the advantages. This is a non-negotiable. Every brand has to do that. But the real game begins after that. Now, again, you would have heard, I'm trying to build a community. The word community has been thrown around and abused a lot, right? But people don't understand why they're building a community. So, for any wellness brand, they need to figure out what is the definition of a community here and how it is built. You have to go a couple of steps back. Are you making a positive change in the habits of people?
True.
Because everything that we're saying, we know for a fact there are research papers, clinical papers written about that it is helping us. But before you and I realize that it's helping us, it has to be a part of a habit, a part of a routine. How does that habit build? You need to put them, or you need to have them come in every now and then. You need to put them in a community of like-minded people. So if both of us are constantly going for ice baths, more than ice baths, it's the whole experience. Both of us, it's like a ritual for us. Our bodies are, and there is a social wellness aspect of it, which is something very, very important. Now, the brands which have been able to do that successfully, which has helped them build a habit. Then once you have a habit, you put all those people who have the same habits together. Because then I cannot fall back on my habit, because what will you think? Oh, I'm weak, I'm not able to sustain my habit. When you have all these people coming together with similar habits, that's when you're actually forming the foundation of the community. The brands who've been able to do that, they've been doing really, really well. But most of the brands, they don't look at it as a long term. They just throw the money, market, get people in, people try. And even for cryo, you mentioned, someone who's never done an ice bath and someone who's so scared of sleeping in an AC at 18 degrees Celsius, they will have a very bad experience with cryo.
True.
Now, once you have a bad experience, you have a psychological fear that maybe this is not for me, and the actual benefit of mitochondrial health, it will never come out. So you've lost that customer, not for now, for life, and not just for your brand, for anyone who's doing cryo.
Yeah, that is right.
So I think that's how I perceive it. It's a very brand to brand problem rather than an overall industry problem, because constantly I've seen the industry, especially the biohacking and longevity, all aspects of it, they are growing month on month, year on year. I was speaking to a few manufacturers in China, especially cryo. This is before the conflict. Their exports to this region for cryos have increased. I was speaking with someone yesterday who's building his own cryo with his 100% electric powered, nitrogen-free cryo, which can sustain up to minus 110, 120 degrees Celsius. So there are pioneers, there are movers and shakers in each and every small element of wellness. But just for the brands who like, oh, cryo is doing well, let's spend 2 million, let's get cryo and let's start selling it. That peddling of wellness is not doing well. If you're trying to look at wellness, oh, I can trade wellness, I'll get this and start selling this, my ROI will hit in 6 months and I'll have 2 centers. That sort of approach, I don't think it'll sustain you for a long term. But the brands who are there for the right reasons, absolutely, it's still working for them.
Oh, very interesting. What interventions are showing the strongest evidence now?
I think so this is going to be a bias, because my last 6 to 8 months, I've been very, very fascinated by what's the whole nuances of the peptide industry. I myself also take it, so I'm more than happy to say that I am a consumer myself. Because
so you're one of the lab rats.
yes. And I did it because I broke my ankle 7 months ago, and football is dear, and like I live and breathe football. I just was figuring out what is the best way for me to get back to the pitch. And when I spoke to a lot of people, everyone pointed me to one direction.
157.
PPC 157, TB 500, that's your stack, start doing it. And I did validate it with a doctor. So being me, since I'm very, very well connected in the wellness industry, I called a lot of doctors, hi, how are you? And without paying any consultation.
Had a coffee with multiple people just to get information.
Yes, someone said, oh, you should directly put it on your ankle. I'm like, there's no muscle there. It's bone. Okay, you can do sub-Q, you can do on your glutes, you can do on your tummy. So lot of different coming in. Then again, our biggest and best friends are ChatGPTs and Claudes. I think everyone was pointing me in the right direction. So I did take a very well-informed choice. But to throw some light on it, until 2 years ago, there was no proper regulation of ED. ED is the Emirates Drug Establishment. And most of the things were taken care between MOHAP and DHA. And as per last year, anything which comes into the UAE has to go through EDE and then comes under the purview of MOHAP and DHA, right? Now, this wasn't there. Hence, so it was like the black market or the gray market, as we say, right? There is a loophole. There is a very big loophole that you can just term yourselves as research-based peptides. And then when the moment I say research-based peptides, that means it's for an experiment and it's totally your responsibility. Whoever is prescribing it to you, they sort of shake away from the liability, which is a very big loophole. And again, when we talk about your conventional medicine or conventional pharma, these things take like years, like decades of clinical trials. Right? So I'll give you a fact here. BPC 157 has gone through a change in legislation thrice in the last 4 years.
Okay.
And in the US, on one fine day, RFK Jr. comes on a podcast and says, you know what, BPC is fine now. You can go ahead and do it. So legislations around this are changing very, very fast. There are trials, phase A, phase 1, phase 2, phase 3, they're being published, but it's still a bit in the air. Because now if you go out and look for these, you can get a BPC for 200 dirhams, and that's absolutely grey market. And then there are the right kinds of people. So sometimes it's not just about the purity, right? It's about under what conditions are you formulating and compounding it. How are you testing for endotoxin? How are you testing for purity? Do you, in the lab that you're making, does it have a GMP certification? The people who are making, the pharmacists, are they under DHA? There are a lot of these smaller nuances. And I've been buried in these nuances for the last 6 months because like I'm founding my own company in this industry. The whole notion and the problem that I'm trying to solve is the same problem that I had. Is what is the safest, easiest and convenient way to get this done, so that if something were to happen to me, who do I go to? This has been that whole research has been so mind-boggling and so enlightening for me at the same time, because I've seen people who are actually driving like the Porsches and the Range Rovers, and they're actually buying it as drugs, as simple as that. They're going black market, ordering, it's coming. Some guy's coming to your parking. He's like, come to my car, sit next to me. This is your BPC. You know how to take it. It's just very, very weird.
Yeah, but aren't we playing with our life in some way?
Okay, so that's a very philosophical question, right? So,
like, I'm a holistic coach, right? At the end of the day, I am all about, you could do whatever injections of all of this, but at the end of the day, lifestyle has to be changed.
Absolutely.
But there's one point, I'm not able to convince my old brain that you're just playing with yourself without actually understanding what could be the repercussions of this in the coming 5-10 years. Right now, it might look fantastic. And everyone has this, like, this statement, oh, it's produced in our bodies. I said, I understand these are produced in our bodies, but what you're injecting is not produced in your body.
Correct.
I mean, I'm not able to convince myself.
So there are two things that I can do here, right? Either I can share my opinion, or I can try to convince you. Which way do you want me to go?
I don't know. I'm just saying, I want your opinion. I think I just had to rant it out.
See, in everything that we do, our brain, we just need to find meaning to what we're doing. I think that's one of the purposes of life, that whatever you're doing, if you're able to find purpose or meaning behind it, that's how our brains are wired, right? So if you're having a very bad pain or a very bad migraine for that matter, and someone tells you, just dip your head in ice and stay there and for like 2 minutes, 5 minutes, and you're like, okay, you've done it once, doesn't work. And the next time it tells you, you know what, if you put your head in water with ice, there is some mitochondrial emission happening, there is this happening, that happening, and like, yeah, it makes sense. So even the first time it doesn't help you, you will keep trying it because someone has now given science-based or justification, right? That's how I look at it, because a lot of the other things now for the vaccines that we had, right? Recently, Pfizer came out that maybe the vaccines, like, they weren't supposed to be taken the way it did. And a lot of, like,
I took all of them.
Exactly. So that time it was a necessity. There were vaxxers and anti-vaxxers. People found meaning in their own causes. Something that I look at is more than what I'm getting is what I'm losing on. So based on whatever research and studies that I did, there are very little side effects on the actual molecule. When we're talking about molecules of thymosin beta, BPC, there are very less adverse effects. Most of the adverse effects which are happening is due to impurities, which is causing a lot of issues, because you can have metals there, you can have lead, arsenic, you can have multiple things, right? So for that very reason, where exactly these things are being compounded became very, very important to me. And then you also need to follow the right set of people. So the moment I see an influencer talking about it, I get a cringe that I don't want to do this because he or she is telling me to. So that's when I call so I have few doctors who I trust and who I listen to a lot. And if they tell me that they've tried it on a 60, 70-year-old patient and they used to have arthritis pain, and 3 months they don't, and that's when I start trusting them more. So my own opinion forming is just I collect as much data as I possibly can, which helps me form an opinion. A lot of people are forcing their opinion on others, which is not the right thing to do. And I still believe going the right route of first having your blood work done, then coming to someone like you, that Kayu, this is my blood work, these are the issues I'm facing, I have tried multiple things, and the biggest and the foremost thing for me is I always have perceived wellness as a pyramid. Like, if you know what Maslow's hierarchy of needs is, like, basic, then you go on to societal, then financial, and then all the way up it's self-actualization, right? Similarly, like, the bottommost layer of that pyramid is movement. If you're hitting the gym, if you're eating right or trying to eat right, and if you're moving constantly, like 5k 10k steps daily, then is when you go a layer on top. You're doing the basic supplements, right? The magnesium, your omega-3s. Over that, you've invested in a good diet or a coach, and anything above that is personalized wellness, which is not going to work as a generic way of measure. It's only going to work when you know your blood work and you're doing something that supports your biology. That's what biohacking is, right? Understanding your own biology. And then I need people like you, that this is my biology guy, you tell me what needs to be done. Then I go to a functional medicine doctor, you tell me what needs to be done. So I think that part is very important. What is happening now, people are skipping the bottom layers. Someone who's not gone to the gym for 2 months is, I'm taking Reta, I'm taking BBC, it's gonna help me. But no, those are not magic potions. Your body will support metabolic healing, recovery, if you're doing the right things, and then you sort of surplus this, you supplement this with. So that is very important to me, and that's how I perceive it, right? So coming back to our original conversation, right? Each and every peptide, I first run it by a doctor. That's a non-negotiable. I asked him, has it worked for any of the patients? Have you prescribed it to any of the patients? And if I were to come to you in this condition, I had a very clear condition. I wasn't doing it for the sake of it, because again, like, the whole stigma of injecting yourself with something, I wasn't very comfortable with it, because I come from India, a very orthodox, conventional way of medicine and health, right? And it just wasn't me. But then when I said, like, this ankle is not healing and I'm struggling, so what should be done? And when they pointed me in the right direction, I asked them, what is the worst that can happen? Like, there aren't many adverse effects which have been publicly documented. At the same time, there haven't been enough clinical trials which are supporting this as well. So if the compound is not done correctly, it could be placebo as well. But I've tried this on my patients, it's been working. I think the fact that GLPs are working across it, people are losing weight, and that you can evidently see. Now, even Reta, for that matter, 30% weight loss.
But that's still not approved.
Still not approved, right? Absolutely not approved. But when we talk about anything above 20% weight loss, we're chartering into surgery territory. Because anything above 20-25%, it was only possible using surgery.
Yeah.
But now there is something which is doing that. So it's got everyone listening, it's got everyone paying attention that what is this? Initially it used to be surgery, and now it's like cancer was this, and now there's a cure for cancer. It's a very vivid comparison. But for people to understand, like, this is how you get attention. And we live in an attention economy, right? Anything which is working and we want to pay attention, you talk about certain numbers which are too good to be true.
Yeah.
And this 25-30% weight loss, if there is a certain thing doing it, and I can say that initially it was only possible through surgery, and now this is a
just
way.
inject yourself with something. We all look for shortcuts anyways.
Yes, shortcuts also work if they're administered in the right way.
Yeah.
And I think, to give you an example, I was just reading this a couple of weeks ago. Around just 10 years ago, for all the gym goers, less than 3% of the people were under any sort of PED, performance enhancing drugs. And most of them were primarily led by steroids, right?
Yeah.
And some are good, some are cyclic, multiple reasons. I don't know much about the steroid industry. But now, owing to the peptide industry, the number is 31%.
Wow.
So in the last 10 years, what has happened so much? And 31%, none of them is steroids. Barely any.
Yeah.
So what is happening? Like, this is just a food for thought for everyone to make their opinion. Because I don't want to force my opinion. It's someone who's interested in this, who wants to go down that rabbit hole and look into what is happening in the gym industry. What are people doing now to ensure that their muscles are intact, they're losing fat at a good rate? And 31% of them are in some or the other performance enhancing substances or products, or whatever you call them, or peptides for that matter. It's a food for thought for them to research themselves. Yeah.
What do you think is the future? If peptides are now, what do you think would be the future?
I think we are already seeing a part of the future already. Now there are tablets available. GLP tablets have come in. So the biggest problem of humans right now is related to obesity, because lack of movement on one side and the amount of stress, these are the two biggest reasons for most diseases.
Yeah, most metabolic diseases are because of that. Yeah.
Correct, right? Now, can we solve for stress? I don't know. I don't think there will ever be a world which will be stress-free.
I want to get that for cortisol. Anything that you can inject and get your cortisol levels down. I think me, who's scared of injections, would still do it. Just jokes apart.
No,
I'm just saying, yeah.
Makes sense, but like, I don't like being stress-free. Like, this is me, right? My brain's always overthinking. What I do like is hacks for managing stress. So, and that's what the misconception is. People think in an ideal world there will be a heaven where it will be stress-free.
No, we need stress in our life to perform in general. Yeah,
absolutely.
To keep us active and going. No, but I understand from a chronic stress perspective, that's kind of killing people now.
Absolutely. But stress is usually coming from one or the other organ, right? Most of the stress is in our heads, we say, right? The brain is sort of pushing in those thoughts when you're thinking, overthinking, and that's sort of leading to stress. But there are other organs in our body. If your liver is not functioning properly, or heart is not functioning properly, it is also causing a lot of physical stress, right? So that is one. The stress part, how will we manage? It's more on the management bit. But the movement part is very highly correlated to obesity. Now, if there is a solve for obesity, which we're talking about right now, can it lead to a lot of these issues, which are issues now, might not be issues in the future? We don't know.
We don't know, but I had this very interesting conversation with an endocrinologist, and he actually was talking about, like earlier people, there was this whole one segment which said, why are you taking a medicine which was basically made for diabetic people and then you're using it for weight loss? He's like, weight loss was never termed as a chronic condition. And now we actually understanding that yes, we require some medication for weight loss, and that's why this medication helps. It was a good way to put that through, because a lot of people don't have this notion, right? Oh, this is something I would never take for weight loss and stuff like that, which is a very good part, that yes, you've got something that will help people who've been struggling. It's not that they're not trying. I know a lot of people, especially my area, I work a lot with women, right? Midlife. they are doing their best that they can do, but they just cannot lose that weight. And if there is a hand holding that comes in, take it. But again, make sure the lifestyle changes are working so that you're just not losing the weight and the muscle, but rather, the fat that's going out and you're actually building muscle instead.
Absolutely. And it is prominent and evident across, especially, let's talk about only Dubai, right? One of the leading pharmacies, compounding pharmacies, they're doing anywhere between 6,000 to 7,000 vials a day, like shipping out.
Okay.
This is one of them. And then there are close to about 5 to 6 major players who are doing it the right way. And then there is a whole sea of people who are doing it the grey way. So the consumption speaks for itself. Like, I was just sitting in a conversation, out of 10 people, 8 of them were on one or the other peptides, right? And it was a very random networking conversation that I'd gone to, someone had invited. So that made me thinking, what is happening? Like, why is this happening? And it's a decision which is made in the US. So FDA has a huge role to play here. Whatever gets passed through FDA is what can come into any region. So ED also works. If it's been passed by FDA, then only ED will actually look into it, and then it enters the entire stream, right? So, and what is FDA? If you think of it, it's just one person making a decision. And that just shocks me, because the world is built on stupid decisions made by stupid people. That's what I believe, right? To give you a context, like, and this is an example that I keep quoting. When the partition happened of India and Pakistan in 1947, the person who was responsible for building the line was a strategist consultant sitting in the UK, and he just said, "Sir, I've looked at the map. This is a line, and this is how we do the partition." Now that line went through villages, houses, communities, families, and in a split of a second, I think a world for 1 million people changed. Now, if he had data that not to go through this village, this is the barren land, this is the terrain, he would have taken a much better decision. But it was one fine day. I don't know, was he sober? Was he having a couple of drinks? Or he just sitting one evening, oh, I have a deadline tomorrow by 9 a.m. I have
just
to
take
send
a pen and go.
We don't know. But when you look at the butterfly effect of that, it's mind-boggling. So every small decision, what it can lead to, we don't know. Someone sitting there at FDA, he has access to trials of 2,000, 4,000, 5,000 people. And there are certain trials which are not even done on humans. Just on even for certain peptides, they're not even like animal trials. So on one fine day, if he says, or if she says, I don't know, he, she, that, this is fit for human consumption, the world changes. Because if the US says, the rest will say, the allies will say, everything will say, it's a much bigger world and we're such a small part of it. We will just listen to, if it's legal, I will take it. If it's not legal, I won't take it. Just like the vaccine, right? So when you think from that perspective, it's like, how do you make meaning out of it? If it's helping, not helping, so then you can only go to the next person you trust. Because I will come to you. Let's say you are my doctor and there are so many things happening. I will come to you, guy, what should I do? Because this is what's happening in the US, this is what's happening now. What should I do? You tell me. And based on what you say, I will try to find meaning. Now, where are you sourcing your information? You're also getting your information from somewhere. You've not done clinical trials. You can't do trials. But I will trust you because you are responsible not just for me, but for a lot of people. That's where the trust chain is formed. And that's what I believe everyone should do. Rather than listening to their friend or the influencer, go to someone who's qualified and who can take a stance that, anything, if happens, you come to me and I will take care of it.
Makes sense. But leading on to another thing which I know we both were talking about, which is actually finding a cause in terms of more preventive medication and personalized medication, which is where the future is headed towards, is the whole epigenetic testing, right? Could you shed a little bit more light on what that is and how it's really going to benefit people as far as their future health is concerned?
So now I'm going to go back a couple of conversations and touch back upon the pyramid, right? How do you achieve personalized wellness or personalized healthcare? Two aspects, right? Blood work. Now, blood work changes every 3 to 6 months. So for you to see any autoimmune or metabolic condition brewing inside your body, it takes about 1 month, 45 days for the parameters within your blood panel to change.
Yeah.
But every now and then, every doctor suggests every 6 months you should do a blood panel. If you're going through certain chronic conditions, it's even every 3 months, right? Now that is one, because it's constantly changing. So you need to be updated what's happening with your body now. But what is the thing that doesn't change is your genetics, right? So, and I've worked a lot in this industry of genetics and epigenetics. So again, genetics is what stays. It doesn't change. Epigenetics is the environment around it which keeps changing, which has a direct implication of genetics, right? So for that matter, I think with the amount of people that I've spoken with who were on the fence of whether I should do it or not, and the people who've done it. So if you ever do a genetic test, you get a very expansive, comprehensive report of 65 to 67. Now 4 years ago, 3 years ago, this was a nightmare, because for someone to get the 65-page report, people are lazy and people don't have enough information and education about understanding and comprehending, right?
Correct.
Again, they will go back to the doctors, and a lot of doctors also, if you've not studied genetics, they would also take some time to go through it.
Yeah.
Now with the models that we have, with the GPTs and the Claudes of the world, they are trained heavily on so much genetic data that it becomes all the more important that the moment you start feeding these reports into them, again, there is an issue of data privacy or whatever, if you're able to get past it. For me, my GPT is, if I'm sharing my genetic data, I want something in return which is very, very personalized, right? A lot of these things which I've discovered about myself is certain foods are not suited. The questions that I've asked my parents, that did my granddad have this condition? Because they also don't know. Back in the day, like depression and all, like were non-existent, like 50, 60.
Couldn't speak about it.
Yes. So now when you deep down into genetics, again, each and every part of your body, which is how healthy your heart conditions, artery conditions, coronary diseases, what is the risk that you possess. It's all about understanding the risk. If I were to tell you today, Gayu, 10 years later, there is a high chance you might have a heart attack, what will you do? Will you wait for 10 years? Or will you start taking charge of your health now, right?
Yeah.
That is the only thing, because you shouldn't heal your body when it needs to or when it's asking you to, because that's doing injustice to your body. It's the same like if you have a car, if you have a really fancy car, you service it 10,000 kilometers.
Yeah.
You don't service it when it breaks down in the middle of Sheikh Zayed Road.
Yeah, I agree. I mean, I use the same analogy.
Exactly.
I have to explain to people about, like, you have a scheduled maintenance for your car, but not for your health.
Now, unlike the car, our body gives us a lot of signs. To understand those signs, to find meanings to those signs, and to break the problem into the most smaller parts, which is each and every genotype or gene, which could potentially lead to something more harmful. Understanding and having access to that information is all about genetic predisposition, right?
Yeah.
Once you have that information, it will always play at the back of your head that, you know what, this could happen. So for it to not happen, I'm going to do something now, not after 2 years, 3 years, 5 years. And even with your parents for that matter, because I think for now I've gotten genetics done for my parents as well, for me to understand that whatever has been plaguing in my family, hope it doesn't trigger the same.
Yeah.
Now, this is about understanding. How it actually works is, again, the doctor that I used to work closely with, Dr. Sajib, he always used to say, like, genes are like loaded guns. Now, when will they fire? You don't know. Who will pull the trigger? That we know. It's stress.
Yeah.
Under any stressful conditions, certain genes are more susceptible to expressing themselves. Yeah. And the moment they express, something changes within your body, and then there's a higher chance you're more susceptible to that condition being plagued, or that condition being there in your body, right? So it could be heart condition, it could be a behavioral condition, it could be a neurological condition, it could be Maxwell's, Alzheimer's. There are multiple things that can happen. So that is very, very important, because when people ask you, right, why stress? What will stress do to me? If you put your body through enough stress, something can like the switch can flick in your body, which can lead to something disastrous. But and that's what preventive medicine is all about. How can we prevent that switch from happening?
So when somebody does this test, what happens? What kind of report do they get, and what are the next steps?
So when someone does this test, it goes through a geneticist. So geneticist, it's the responsibility of the geneticist to tell you the risks parameter, because most of the reports will give you a stress or a risk indicator that for certain condition, let's say Alzheimer's, for example, right? It's a very grave condition, and it tells you if you have a low, medium, intermediate, or high risk towards this. So it's very important for you to understand what are the high and intermediate risk elements. Once you have a clear understanding that these are all the conditions where I'm more susceptible, then it makes sense for you to go for specific tests. And this is all about cancer, about all these grave neurological conditions. The sooner you get to know about them, and again in cancer stage 1, stage 2, after stage 3 it becomes little hard, and no one wants that. And I would never, because I have some very close people of mine who've suffered majorly because of this enemy cancer. So the sooner you're able to understand and diagnose these things, it's important. But again, one fine day you don't wake up and go for a cancer test. No one does that. So the genetic predisposition is the gateway for you to understand what you should do next for your body, for anything that can have an impact in the future. It's very, very important. So understanding the predisposition, you're predisposed to some of the other risks, becomes all the more important, because you have a direction, and all we need in our health is a certain direction. If someone tells me to go to this doctor, that's a direction. If someone tells me to do this test, that's a direction. But who's gonna be telling me that? This is where I think genetics and blood work plays a huge role.
Oh, that's very interesting. Moving on to some fun element called the hot seat cold truths. It's like a rapid fire round for you, whatever comes to your mind. Is biohacking becoming a rich person's hobby?
Yes, because then they're boasting about it on their socials, which is again creating a huge gap between someone who's trying to get to step 1 of biohack, and then the moment they reach to step 1, there is a step 100 already being there. So I think the gap is becoming wider. It doesn't need to be wider.
What's more important, genes or habits?
Knowing genes, building habits.
One health belief you held 5 years ago that you no longer believe?
I will not inject anything else.
What's the first thing you'll do if your biological age came back 10 years older than your actual age?
I will go for a professional football career if I can.
Would you rather know your biological age or your death rate?
Both of them are very correlated, but I would want to know at what age my body is dying.
Okay, so your death rate would be something that you'd want to know. Okay. What's one thing the healthcare industry doesn't want people to realize?
That there's a cure for each and everything. They're not going to tell you about.
Okay. If you had 100,000 dirhams to spend on your health, where would you spend it?
I would buy a hyperbaric oxygen chamber.
Okay. Because the air around is not really pure, and you think pure oxygen is going to help?
I have a chronic condition related to, it's called cluster headache. So I have realized the importance of oxygen. That's I'll just go and buy
that. Okay. So it's there on your list already. Things with this budget, this is what I'm going to buy. Okay. So if you could only track one health metric for the rest of your life, what would it be?
HRV.
Okay. Wearables, game changer or anxiety creator?
Game changer if you don't get influenced easily.
It's because the stats are good stats that you get.
The subconscious conditioning. So I wore Whoop for a year and a half, and then I've not been wearing it for the last 4 months. And I give each and every day the same importance that it deserves, not looking at my recovery or my strain or my score, because like I was becoming lazy if I was in red, thinking today I should take it light. So a lot of subconscious conditioning was happening. Now that I understand more, every day is a new day. We go out, we do our best, we come back, we sleep.
Fantastic. Most overrated health test?
Every test has like a specific reason as to why someone should do it. But at a young age, if you're doing a lot of these grave tests, before doing the basics, that is a no-go for me. To give you an example, like you're in your 20s and 30s and you're going for a specific test for a cancer.
Yeah.
Or
an NAD test at that time. I mean,
yes.
yeah, it's gonna, your mitochondria is at its peak at that time.
Yeah,
There's
yeah,
no use getting all those tests. Yeah.
So there is a right time and age for all tests. But just the fact that you have money and you want to show people that I've done all these tests, that doesn't make sense for me.
Okay, fantastic. Thank you a lot for very interesting information. But before we go, any parting advice to the listeners, especially, with the whole noise around healthcare, biohacking, it's just, there's so much noise. What would your advice be?
I think if you can, I think actively take out some time and research. Like, read a lot about what's happening recently, because people sometimes still pick up books which are like 10 years and 15 years ago, and they go to doctors who've done just conventional medicine. So first understand the demarcation between what conventional medicine and functional medicine is, and the difference between symptom management and root cause management, and try to imbibe that thought process in your life as well. Because even in our life, we look at a certain symptom and we try to throw money and solve for it without looking at the root cause. I think the whole definition of functional medicine has done like such brilliant rewiring in my head that I keep going back to first principles thinking to understand root cause of any business problem as well, strategy problem as well. So I would definitely ask people to read, because everything is very social driven. Don't listen to your next influencer. Don't listen to a Huberman podcast if you've not done the basic research as well. First, try to understand the basics and try to figure out after movement. Movement is basic. If you're not going to the gym 3 or 4 times in a week, everything else is just a facade that you don't need. If you can build certain positive habits, that's the first target that you should have. The moment you have certain positive habits, then you start looking into the wild west. Unless just look at it as a movie which is playing in the background and you're well. And spend time with your loved ones, hug them, speak heart to heart at least once a week with someone, be it your parents. Nothing's better than that. And then there's a whole world waiting for me when you're ready. But before you're ready, just chartering into it can get them confused, can just throw them in a direction which they never asked, and that's when people have a bad experience with this.
Fantastic. Thanks a lot, Mohit. I think you made it very easy for people to understand, especially me, like I said. I think I had a fantastic conversation with you. It was brilliant having you on the podcast today.
It was an absolute pleasure and absolutely loved your questions. Thank you so much for having me.
Thank you. Clearly, the future of healthcare isn't just about living longer. It's about living better for longer. If you enjoyed this conversation, please make sure to subscribe to the Gaio Lewis podcast and share this episode with someone who's curious about what the future of healthcare looks for them. I'm Gaio Lewis, and until next time, menopause, why pause? Let's play.